Hello and welcome to this presentation over trichinolosis. As a forewarning, I may uh, mispronounce a few key terms, so sorry in advance for that. This presentation is for Survey of Human Diseases, and it is my disease prevention presentation. My name is Madison Corneli, and in these next few minutes, I will discuss what trichinolosis is, the causes of this disease, sources of infection, the parasite's life cycle, symptoms of the infection, and preventative measures. According to the National Library of Medicine, trichinolosis, also called trichinosis, is a parasitic infection caused by roundworms, nematodes, from the genus Trichinella. Trichinella. Sources of infection include wild boar, brown bears, Eurasian lynxes, badgers, moose, and other large herbivores, and livestock. Swine are of particular interest when discussing trichinosis due to their tendencies towards cannibalism and eclectic taste as omnivorous scavengers. While humans can be infected by all species of Trichinella, Trichinella spiralis is the most common and mainly infects mammals. According to the CDC, trichinosis is caused by nematodes, roundworms, of the genus Trichinella. In addition to the classical agent T. spiralis, found worldwide in many carnivorous and omnivorous animals, several other species of Trichinella are now recognized, including T. pseudospiralis, which is found in mammals and birds worldwide, T. nativa, which is found in Arctic bears, T. nelsoni, which is found in African predators and scavengers, T. bertovi, which is found in carnivores of Europe and Western Asia, and T. papae, which is found in wild and domestic pigs in Papua New Guinea and Thailand. Interestingly, Trichinella zimbabweensis, I probably pronounced that terribly, is found in crocodiles in Africa, but to date there are no known associations of this species with human disease. The domestic and Sylvatic cycles differ slightly, however, the mode of transmission is similar. Livestock may engage in cannibalism as well as be fed food scraps containing meats containing encysted larvae and striated muscle. Cannibalism amongst livestock is most commonly found in swine species and poultry species such as chickens. Animals in the wild are less likely to ingest the larva via cannibalism of infected individuals. However, they are more likely to become uh, infected through means of predation and scavenging. Humans can then become exposed and infected by consuming meat from these animals. After ingestion, the larvae are released into the small intestine. Once they are in the small intestine, they mature into adults. These adults then deposit larvae into the mucosa. These larvae then enter the circulatory system, where they are then eventually encysted in striated muscle tissue. This process is standard across all animals and doesn't really differentiate between domestic and Sylvatic cycles, except for the fact that the cycles differ in their modes of uh, infection. To the left on the screen, you will see a diagram that's provided by the CDC that shows the cycle and the ways the life cycle within an infected human of the disease. To the right top is a picture of a taken through a microscope of encysted larvae inside of striated muscle tissue. And directly below it is a close-up picture of one of the larvae of the parasite. Location. Although this disease is found across the world, it is most prevalent in Europe, North America, and South America. Countries and areas where healthcare and testing are less accessible are at greater risk. Cultures in which horse meat and wild boar are considered delicacies are also at a higher risk due to an increased risk of exposure. Symptoms. Symptoms of infection depend on the stage and severity of the infection. Light infections may be asymptomatic. Wherever the larva or adults tend to reside, symptoms appear correspondingly. Gastrointestinal symptoms are common as the larvae appear in the intestines, while migration into muscle tissue can cause paraorbital and facial edema, conjunctivitis, fever, myalgias, splinter hemorrhages, rashes, and peripheral and eosinophilia. Occasionally, especially in those with weakened immune systems, life-threatening symptoms can occur, including myocarditis, central nervous system involvement, and pneumonitis. Excuse me, pneumonitis. Yes. As the larvae begin to be encysted in the muscle, symptoms lessen. There is no treatment once the larvae embed in the muscles, but supportive care such as pain relievers can help. Gastrointestinal symptoms tend to appear 1 to 2 days after eating infected meat and are often the first signs of infection. Other symptoms can appear 2 to 8 weeks after infection. The length and severity of symptoms is dependent on the number of parasites ingested. Symptoms often dissipate after a few months as the body's immune system fights the parasites. Unfortunately, fatigue, mild pain, weakness, and diarrhea may stay in the patient for many months or years. Eosinophilia is found in nearly every case, unless the case is so severe that eosinophilia is suppressed. Eosinophilia is the presence of too many eosinophils in the body. An eosinophil is a part of a group of cells called white blood cells. They are measured as part of a blood test called a complete blood count. While eosinophilia can have causes that aren't due to the underlying disease, such as allergies, in this case, they are due to the presence of the parasites. Prevention methods. There are primary, secondary, and tertiary prevention methods that are available to prevent and treat infections. Some of the primary preventative methods are to avoid hunting in areas known to have animals carrying the parasite. It is also important to avoid feeding livestock with questionable sources, such as meat that may be infected with it, and there was a trend for a while there for people to feed the carcasses of deceased livestock back to the livestock, which is a very bad idea just in general, but specifically in order to prevent parasitic infections. Secondary prevention methods include lab testing meat and cooking all meats thoroughly, especially pork and other swine varieties. Tertiary prevention methods include medication, including mebendazole and albendazole, and quarantine of infected meats or animals. One of the most important prevention methods for trichinosis is to cook all meat thoroughly. The rough guidelines provided by the CDC are 145 degrees Fahrenheit for cuts of beef, pork, lamb, and veal, 145 degrees Fahrenheit for fish, 160 degrees Fahrenheit for hamburgers and other ground beef, and 165 degrees Fahrenheit for all poultry. If you suspect your meat may be contaminated with trichinella, firstly, I would definitely suggest against eating it. And secondly, there are laboratory tests available. After infection, it is important to seek medical attention. Medication, often including mebendazole or albendazole, is prescribed for trichinella infection. Meats of infected animals as well as living animals infected with trichinella should be quarantined and possibly destroyed. While it is important to note that person-to-person spreading of this disease isn't quite possible, except for in the case of cannibalism, which is its own issue. Sorry. It is important that any infections be reported and promptly treated. In addition to medical interventions such as antiparasitics and antibiotics, supportive care is also important to recovery. Rest is important due to irritation of muscle tissue being a major symptom in later stages of infection. Over-the-counter medications such as Tylenol, aspirin, and ibuprofen can be used to treat pain associated with infection. Hydration and nutrition are vital to recovery in regards to any disease, but especially so in this case. I would like to thank the Center for Disease Control, the National Library of Medicine, and Reisner E. and Reisner H. for their book, Crowley's An Introduction to Human Disease. Also, thank you to SlidesGo, where this formatting for this presentation is from. Thank you for watching my presentation, and I hope you learned a lot. Have a good day.